The gentleman from Ohio, Dr. Wenstrup, is recognized.
Thank you, Mr. Chairman. I move to strike the last word. You know, I ran for Congress because I saw people making healthcare decisions who had never seen a patient. And for the first time in a while, I can proudly say that we're not doing that here today. This bill has been a top priority for the Doctors Caucus for a long time now. As a co-chair of the Doctors Caucus, I want to first thank Representatives Del Bene, Kelly, Barra, Bouchon, and Senator Marshall for their hard work on this. And I want to thank the committee for listening to the members of Congress who have been involved in patient care. I'll back that up. When I first started in practice, I ran my own practice, and I remember being able to stick and palpate a patient's muscle and then getting denied an MRI, which I needed. And I would call the insurance company and get a doctor with a completely different specialty on the phone, and they would deny this care for a patient. And I would say, well, you're not treating the patient. You've never seen the patient. And so we want some remedies for this type of thing. So this bill will be revolutionary for patients and healthcare providers across the country. It'll reduce workforce shortages. I was at one of my local hospitals, and I saw 4 nurses, and their only job was to get prior authorization at the pediatric ophthalmology clinic before they could treat somebody. First of all, we have a nursing shortage, and I think there's a lot better things that the nurses can be doing. And that's not why they got into patient care. So this will ensure that seniors are receiving the care they need it when they need it. Real-time decisions will mean that the patient doesn't have to leave the doctor's office and come back. I think about what it'll mean for the patients in rural communities in my district. And finally, it'll take government and really insurance companies, but in this case government, out of the doctor's office just a little bit more. So thank you again, Chairman Neal, Ranking Member Brady, Representatives Del Bene and Kelly for convening this markup today and for your hard work. Today we're putting patients over paperwork, and it's greatly appreciated. This bill is critical for patient-centered care, and I urge its swift passage out of committee and on the floor, and I yield back.
Thank the gentleman.